Welcome to the coronavirus pandemic. I'll take coronavirus for 100. Fever, chills, shortness of breath, loss of taste or smell. What is stay at home and isolate? Correct. Coronavirus for 200. Inability to stay awake, persistent pain or pressure in chest, trouble breathing. What is seek immediate help? Correct.
Coronavirus for 500.
Crippling and potentially dead infectious disease eliminated the United States with vaccination.
What is the polio vaccine?
Correct.
I'll take coronavirus for 700.
The Daily Double! Should I take the coronavirus vaccine? Wait. Hold up. This is not a game. It's time for serious discussions. We have coronavirus vaccines, but not everyone is comfortable taking them. Here's the facts. Based on what has been proven about vaccines for other diseases, COVID-19 vaccine may help keep you from getting seriously ill, even if you do get the virus. Getting vaccinated also may protect people around, particularly those at greater risk for severe illness from COVID-19. We don't yet have all of the answers. Get informed, talk to your healthcare physician, and make the right decision for you. This is a message supported by the Washington State Department of Health.
Hi, I'm Paul Pearson of StarTime. Did you know that back in the 9th century, Rainier Avenue Radio was the host of the first annual Gregorian chant-off? Man, that was tight. Well, times have changed and so have we. Now you can hear all the great Rainier Avenue Radio shows on our mobile app for Android and iPhone. It's completely free on the Google Play Store and the iPhone App Store. The Rainier Avenue Radio app.
Join Rainier Avenue Radio from 5 to midnight for Sunday evening sound sessions. Jazz from the cabinets from Big Poppy.
That's right. It's time once again for Jazz from the Cabinets with Big Poppy.
Sergio LaCour's Love Line.
It's Sergio's Love Line with Sergio LaCour. Go to the phone line. Tell her who we talking to.
Sage Prince and Just My Opinion.
This is Sage, and that's just about going to do it for the first half of Just My Opinion.
K-Fox Night Beat with Nasty Ness Rodriguez.
It's the beat of the Fox. K-Fox Night Beat, Nasty Ness.
You know what? You're going to listen from 5 to midnight. Just turn it on and don't stop. DJ Alibaba. The Underground Surround Sound Star Time with Paul Pearson.
Thanks for tuning in. My name is Paul Pearson.
Sunday evening sound sessions on Rainier Avenue Radio. Trust me, you'll be listening the entire time from 5 to midnight. Sunday evening, your sound session on Rainier Avenue Radio.
This is Tyrone with God Is and the inspiration of gospel music also on RainierAvenueRadio.org. We give out free food each and every Saturday from 11 to 2. And so we want you to come on out and support us when we love on your community. And we also have a fish fry once a month. We want to raise funds, put back into the community. And so come on, support us. We need your love. And also, if you want to be connected with us, go to RainierAvenueRadio.org, and to the website, Facebook, Instagram, and God Is. And as God Is got a website, we need your help, community. So come on out and get your free food each and every Saturday it is. And so we asking for donation, whatever you feel to give from your heart to the mind. And as we're doing it right here for you, go to our website and touch love and give back. And so come on by 810 23rd Avenue, RainierAvenueRadio.org, your community radio station and inspiration of all the things we do in your community.
Rainier Avenue Radio, your community radio station will provide you with more information. Rainier Avenue Radio.
Hey! Welcome. This is Brenda Charles-Edwards, the host of Seniors Matter. We are here live every Friday at 12:30 p.m. Pacific Standard Time on www.RainierAvenueRadio.world, your community radio station. You can also listen to us on YouTube, Facebook, Twitch TV, and of course, the Rainier Avenue Radio app. We feature interviews with people that provide services or have valuable information for seniors, their family, and the community. Do you need financial documents notarized? Are you a senior that needs documents read to you for clarity or completion? If so, call me, Brenda at Black Orchid Notary, 206-683-2636. Tell me where, I'll meet you there. This February, we celebrate African American History Month. Learn about how heart disease, cancer, and stroke impact African Americans and how to improve your health. Today, my guest is Jasmin Tucker. She's a program coordinator with AARTH Ministry. Her passion for supporting people in their journey to better physical, mental, and emotional health has led her to her current position as AARTH's Living Well with Chronic Conditions Program Coordinator. Welcome to the show, Jasmin. How are you?
Good. How are you? Thank you for having me today.
Oh, it is a pleasure. I'll tell you, I was telling my husband earlier, one of the things that I like about AARTH, and I know Mary, and shout out to Mary because she recently retired. And my good friend Kathleen Wilcox is now the new executive director. And I know she's going to do a great job and just take things soaring across the skies.
Yes.
But there's so many young people involved in it. And to me, when I talk to people about Seniors Matters, they think only old people are involved with giving out information. And it's like, you guys are so full of youth, vigor, vitality, and you care. And that's what I think is so great about AARTH. And in fact, let me let you say what AARTH stands for, because I'm just giving the acronym of it.
Yes. So AARTH is African American Reach and Teach Health Ministry. Yes.
So I can't remember when Mary founded this, but it's been a while, I know.
Yes. So 2 decades ago, Reverend Mary Diggs Hobson and her son, Reginald Diggs, they founded AARTH. Reginald Diggs has since passed. And in addition to Mary Diggs and Reginald, we also have the retired pediatrician, Dr. D. Maurice Moses, and he supported founding AARTH. And he really just wanted to support his former patients living with HIV. So those are our founders. We were started about 2 decades ago.
Wow, that's just incredible. So what programs are offered and what do you do specifically at AARTH?
Yes, so the programs that are offered, we have an array of programs that include over 40 HIV/AIDS courses, health equity and social justice curriculum, and capacity building, as well as clinical preceptorships, clinical consultations, web-based learning and initiatives for professionals providing healthcare, treatment, and education services for people of African descent. We also have our Elders Living and Aging Well program, which focuses on senior health promotion. Workshops and trainings include health and wellness, life skills, education, and support preventative health screenings and assessments. Other programs include our digital equity work, where we provide technology devices such as laptops, tablets, even hotspot devices, as well as the training to utilize those devices and certain applications such as Zoom, Facebook, and select hospital portals to access MyChart and telemedicine visits. The digital equity work increases social connectivity and provides folk with the training needed to access health information and health appointments virtually. And as the list continues on with services.
I'm just going to say, I should have asked, what don't you offer?
Right. So continuing on, so we offer more. We offer our chronic disease self-management workshops and trainings, which are courses that support those living or caring for someone with chronic conditions. And then also in the era of COVID-19, we also offer COVID-19's vaccinations and boosters. And that includes J&J, Pfizer, Moderna, and pediatric vaccines.
Wow.
Yes, it's a lot of work.
Yes, it is. But what gratifying work it is. I had an opportunity to work with AARTH as well as the Central Area Senior Center. I was representing Mount Zion because I was on their health ministry, and we vaccinated over 4,000 people, but seniors mainly. I mean, there were some other people, but I mean, that's a lot.
Yes.
And including and we did boosters too for those same people, plus a couple more. But I mean, it was just overwhelming when I realized how many people we had vaccinated.
Yeah, and to date, we've actually vaccinated over 7,000 individuals within our community. And that includes the, the first and second dose, as well as booster. And then we just recently started the pediatric vaccines.
How's that going?
We'll have to check in with our staff, but I heard it's going well. We have an array of clinics coming up, and I'll provide those dates. So the next dates for our vaccine clinic is going to be Saturday, February 19th at 10 a.m. We'll have pediatric vaccines available. The next one is Tuesdays and Thursdays in February, so this month, as well as Fridays and Saturdays. And they're going to be at New Beginnings Christian Fellowship, as well as South Seattle Senior Center. And all registration for the vaccine clinic can be done on our website, and that's www.arth.org.
That is great. Oh, man, you guys are doing it. I told you. So what is your focus population?
Yes, the focus population at AARTH is going to be those who are African born, as well as African American seniors, unpaid caregivers. So those who are unpaid, take care of family or friend 18 and over. And then also folks living with chronic conditions and HIV/AIDS. And we also partner with local organizations to do organization restructuring and provide trainings and educational workshops.
And I just remembered something. You guys also have given out PPEs, because I spoke to someone that received it, and as well as some air fryers.
Yes. So we do have PPE available. Specifically, we have N95 masks that are available, hand sanitizer. We're working on getting some COVID tests in. That's still in the works. And yes, we did give out, I believe it was 40 air fryers to the unpaid caregivers over at the senior center. So we did give those out, and that was really exciting. That happened around Christmas time. And so those air fryers definitely went into good hands. And they also came with an air fryer cookbook. So
oh my goodness.
That was really fun to get all of those wrapped up and everything and sent out for Christmas time.
That is great. So what areas do you guys serve?
Yeah, so we are regional. So some of our work we do support in Washington, of course, Utah, Oregon, Alaska, Colorado. And then for some programs specifically, we support folks that are living in King County. But anyone is welcome to attend our workshops. We have folks who tap in from Chicago, Florida, Georgia. So really, I mean, people are hearing about us. And if you want to come to our workshops, you're more than welcome.
Well, what makes it so easy is because it is virtual, so there's no excuse not to do it.
Right. So everything's virtual. We are utilizing the Zoom platform. And so, for folks who don't know how to use it, you can join us by phone by dialing in. And myself, as well as the other program coordinators, we're more than happy to help folks get online or have them join in by phone. And thanks for pulling up our newsletter. This is all the exciting and fun events that we have going for the month of February.
Yes. And Daniel, can you pull up this is killing me. The COVID shuffle.
Yes, the COVID shuffle. These ladies are getting down.
I know. I looked at that and I said, I can't believe that. If I'm going to continue on, but when you get it, Daniel, just go ahead and play it, because this is great. I mean, what a way to advertise and getting the vaccine. But if you're just tuning in, you're listening live to Seniors Matter with your host, Brenda Charles-Edwards, on www.RainierAvenueRadio.world, your community radio station. We're here every Friday at 12:30 Pacific Standard Time. Do you know what the best gift we can give ourselves and our loved ones? Join me on Zoom for a group or individual session on Speaking of Dying, End-of-Life Planning. Call me at 206-683-2636. Now back to my lovely guest, Ms. Jasmin Tucker. She's a program coordinator at AARTH's Living Well with Chronic Conditions program. So how are you serving the community virtually and in person? And in particular, I know you have a lot of programs that are virtual, but what are you able to do in person?
So right now, we have not provided any in-person workshops. It's just right now the COVID-19 vaccinations that are in person. With the current COVID climate, we want to keep our seniors and everyone safe. And so right now, everything is virtual. As the COVID climate changes, we're going to be looking at different ways that we can serve folks in person. But right now, everything is currently virtual. And you know what? Although it's virtual, people are still coming. People are still joining us. People are on vacation in Mexico, tapping into our event. So I think virtual allows you the opportunity to join AARTH and our facilitators and everything that we do, no matter where you are. So I really do enjoy the virtual setting, but we're excited to get back to seeing people face to face soon.
I understand. So my producer says he has the video. So play it, Daniel. Just got me jumping up. I tell you.
They are getting down. I mean, I can't even do those moves.
I know. I was like, okay. I mean, I can move with the beat, but not quite like that.
Right.
So what events did you host for the community last year?
Yes. So last year, we did an array of events. For my program specifically, we did our support groups with Dr. Washington Harvey, and we focused on self-care. So we met for a total of 9 sessions, and it was about 10 of us that met each week. And we talked about, one, what is self-care? How do you engage in self-care on a daily? And also with that, boundary setting. How do you set boundaries? We talked about emotional self-care. We talked about physical self-care, spiritual self-care. And then at the end of the self-care support groups, folks had the opportunity to make their own individual and even family self-care plans. So that way at the end, they had something tangible to take with them and utilize now that the support groups were finished. And it was really beautiful because even though we completed the support groups with Dr. Washington Harvey, the 10 ladies actually decided to continue meeting with each other because they built such a great bond. So that was one of the things that we did was the support groups. We also did cooking workshops with Chef Aduni. She is a local food scientist in Seattle, as well as she's owner of the Taste Tutor. And she did various different cooking workshops, and that included making soulful and plant-based recipes. We did plant-based red velvet cake. We did.
Are you serious? Wait.
Yes. Jerk chicken wings.
Red velvet cake.
Yes.
Oh my gosh, that's one of my favorites.
Yes. In addition to that, we also did our CDS&P workshops, which I'd like to talk about in detail later on. And then also we did our technology project with tablets. So we gave out 30 tablets to patients at Harborview Medical Center, and they got their tablets. They got their manual on how to use it. If any of them didn't have internet connection, they also got a hotspot. And with that, we also provided training. So we had our technology consultant, Twanda Hill. She did some trainings with the folks on how to utilize the tablet and also some applications such as Zoom, Facebook, MyChart, and how to access a telemedicine visit. So that's what we did for my program last year.
Wow, that's really impressive, especially
Yeah.
with the tablets. And I know about my chart. I've got that. So, and that's really key, and it helps you understand what's going on with you.
Right.
That is
Right.
wonderful.
Yeah.
So, what events are you hosting this year that you are most excited about?
Yes. So some of the events that we're hosting this year, we have our CDSMP. So it's our chronic disease self-management workshops. They're evidence-based. They're 6-week workshop. I recently got trained to be a certified leader for this curriculum. But it's a 6-week workshop. It's over. Right now, we're exploring doing it over the phone. So we're carrying out that training to provide it over the phone. But right now, we're doing virtual. And we go over an array of topics over the course of 6 weeks. And that includes creating action plans. So picking out what you want to do within that week. And then telling everybody how you're going to do it, when you're going to do it, why you're going to do it. And then we also talk about getting a good night's sleep, guided imagery. And it's 6 weeks of just all these different topics. And it is evidence-based work. So it is really exciting. It makes a lot of difference in people's lives in dealing with their chronic conditions. And then another workshop that I'm really excited about doing is our financial planning. So we're doing a financial planning seminar. We're going to talk about retirement, generational wealth, personal money management, as well as end of life planning. So I'm really excited for those events. Yeah.
Tell them why I'm laughing.
Yes. So she is laughing because Brenda is going to be our facilitator for the end of life planning workshop within that financial planning seminar. So I'm really excited to get a chance to work with her and really show our community, how do we financial plan? How do we plan for end of life? So it's really excited, and I'm definitely excited to work with Brenda.
Likewise, Jasmine. That's great. I wasn't sure that when you said that, I said, okay, so they made that decision. Okay, that's good. I like that.
Still in the works, but it's happening.
Hey, I'm there with you.
Yes.
So how can folks keep up with the happenings at AARTH and attend events?
Yes. So you can always, for folks who can't navigate to our website, you can always reach out to me. My email is Jasmin T. So that's JASMINT at AARTH.org. If you are actively on the internet, you can go to our website, www.arth.org, navigate to our events calendar. And from there, you can click month to month and see what events we have going on. And you can click on the event and it'll take you to our registration page. And we'll ask for some demographic information. And then from there, you'll be provided the Zoom link. And then we'll just be in touch up until the actual event. And we'll get you all set up to join us.
I just thought of something. How is AARTH funded?
Yes. So AARTH is funded through various funders, including Mountain West AETC, Northwest Kidney Centers, Bill and Melinda Gates Foundation, Harborview Medical Center, City of Seattle, Human Services Department, Fred Hutch, King County Veterans and Seniors, Human Services Levy, Seattle Foundation, Sound Generations, Seattle Neighborhoods, Outreach and Engagement, Seattle's Cancer Care Alliance, as well as direct donations from our website.
Wow.
Yes.
Boy, AARTH has come a long way.
Yes, we have.
This is so wonderful. Oh, man. So are there any volunteer opportunities?
Yes. So Angela Yancey Watson, who is our lead program coordinator, who will be on the show in the coming weeks. She'll talk more about the community navigation program. Basically, we're looking for community navigators, those who are active within their church and other settings, to really just advocate about AARTH. Spread the word, get people registered. And there's a set amount of hours, I believe 10 to 20 hours each month. That is it's a paid volunteer opportunity, and really just share about AARTH, share our flyers, and you can get involved that way. Also, we're going to be doing a training for our chronic disease self-management work that we do. And that's also a paid opportunity, but it's technically a paid volunteer. So you can volunteer to do the training. The training is unpaid, but once you've completed the training, you are then able to carry out the CDSMP work for us and become a facilitator. And with that, once you've completed a workshop, you're paid $250. So those are the two options that we have now to get involved. And we're always looking just for unpaid volunteers to come in and help with COVID clinics and, administrative work in the office.
Right. Well, that's good to know. And
Yes.
almost anyone can answer a phone. Almost.
Yes.
Almost. Must have a script.
Yes.
Geez, we have covered so much, Jasmin. I can't believe all that AARTH is doing. And I know it's going to be doing more. How do you measure your impact in the participant improvement?
Good question. So for our events, we do a series of feedback surveys. So for the chronic disease self-management work that we do, we have a short survey at the end that where participants let us know what they've learned, any feedback that they have for us. For other events, we do like to measure current understanding and learnings of that set topic. So for example, our cooking workshops, we like to understand, how do people prepare their foods now? How long does it take them to prepare their foods? And then once they're done with the workshop, we then do a post-event survey and then get an understanding of how their learnings have changed. And then we do report that data to various funders, as well as keep it in our internal database.
That is great.
Yes.
My time is almost up, but I want to end my show with the COVID shuffle again. So I'm going to say that this is Brenda Charles-Edwards, host of the Seniors Matter show. You can listen to us live on Rainier Avenue Radio.world, your community radio station, YouTube, Facebook, Twitch TV, Twitter, because I forgot that last time, and the Rainier Avenue Radio app. We're here every Friday at 12:30 p.m. Pacific Standard Time. I want to thank my audience for listening, and a special thank you to my guest, Ms. Jasmin Tucker, Program Coordinator at African American Reach and Teach Health, and her co-partner or the lead program direct coordinator will be on here February 18th. So you don't want to miss that too. So I'm going to say, have a great weekend. Be safe. Live your life like it's golden. The coronavirus special edition is going to be up after the COVID shuffle. Thank you so much, Jasmin, and we'll be talking soon.
Thank you. Thanks for having me.
Hit it, Daniel.